According to this ADA form and case study, our 59-year-old patient is of average weight and is 5'6". She indicated that she does brush or grind her teeth and notices soreness in her jaw as well as ulcerations on the roof of her mouth. She states she tries to keep a pretty active lifestyle as her health is important to her. Unfortunately, she has not seen a dentist in over a year as her previous dentist retired. Her chief complaint is a lump in the roof of her mouth, and she wants to achieve a wider smile, which is why she uses baking soda to brush her teeth. In regard to her medical history, she is pre-diabetic, has hypothyroidism, and bronchial asthma. It is important to note that our patient is also allergic to latex and is sensitive to many aerosols. She also quit smoking 10 years ago and has family history of cardiovascular disease and stroke in 2 of her immediate family members. As far as her medication, she takes albuterol, a beta agonist that is used to treat bronchospasms in patients with reversible obstructive airways. A side effect of this medication is xerostomia, but our patient does not indicate she has this problem. As well as levothyroxine, an oral thyroid product used to treat her hypothyroidism. This medication has no related contraindications for dental treatment. In her comments, her vitals are recorded. Her blood pressure is at 128/79. Her pulse is 75 beats per minute, and her respirations are 15 breaths per minute. Taking into consideration her medical history and vitals, this patient falls into the class ASA2.
Are you a periodontal detective? Let's find out more by discussing periodontal assessment results of our patient. Our patient generally appears to have healthy, stippled gingiva, but presents whitish pink bulbous gingiva with localized inflammation on posterior teeth of all quadrants. Gingival margins on posterior teeth appear reddened with rolled borders. Inner dental papilla appears normal, and bleeding on probing is observed in all areas of all quadrants, but it's more prominent in the maxillary left. Probing depths range from 2 to 3 millimeters and 4 millimeter in localized areas with more inflammation and bone loss. Plaque score is 15%. Bleeding on probing is more than 10%. Periodontal pocket appears to be less or equal to 4 millimeters. Clinical attachment loss is present. Recession is present on posterior molars of all 4 quadrants, but it's more severe on the maxillary and mandibular left quadrants from premolar to molar. Patient presents no furcation clinically or anatomically. Patient appears to have slight mobility on teeth number 13, 18, and 20. Our patient is a class 5 medium heavy patient with stable periodontitis. According to AAP, our patient falls under stage 2 with generalized radiographic bone loss at the cornal third of her posterior teeth, mostly horizontal bone loss and localized probing depth of 4 millimeters on upper right quadrant.
Let's take a look at our patient needs assessment. She interested in teeth whitening, and we recommend over-the-counter product contain 14% hydrogen peroxide. There is no report of anxiety or bad dental experience for her. But she has latex allergy, so we use nitrile gloves during procedure. She also has asthma and hyperthyroidism and prediabetes. For clenching and grinding, we offer her mouth guard. There is no concern regarding head and neck. She has 2 implants with bone loss, and we offer scale and deplaque all area. And she needs hand-on guidance on oral hygiene care, so we educate her. She often has a burning sensation in roof of her mouth, so we offer an occlusal guard and advise her to discontinue alcohol-based mouth rinse and baking soda because it irritates ulcer. Now we start giving her appointment based on her medium heavy coat. We give her 4 appointments. In first appointment, we do initial assessment. Second appointment, we do scaling root planning on upper and lower right side. Third appointment, we do scaling and root planning upper and lower left side. And last appointment, we reevaluate it and make her 3 months maintenance.
The lump she complains of is a common form of exostosis called torus platanis. This is a bony protrusion found on the hard palate. We advise our patient that it is best to leave this growth alone as it does not interfere with stable periodontium. To summarize, we classified our patient into ASA physical status 2 as her thyroid condition and bronchial asthma is well controlled, while her periodontal assessment shows she fits into AAP class 2. With that being said, thank you all for watching.